empirical therapy in IVF. While it's true that IVF technology has improved dramatically and pregnancy rates have become much better, the fact still remains is there's lots of stuff we still don't understand about IVF, and there are lots of things which we still can't control. And I think this is why what we call empirical therapy is perfectly acceptable, provided patients understand what they're signing up for. Let's look at a common example. For example, stuff which a lot of doctors do after the embryo transfer to increase the chance of embryo implantation. The reality is that there's very little which we can prove definitely helps to increase the chance of implantation, which is not very surprising because it's a black box area. We can't control it, we can't test it, we can't monitor the process, and we know that most embryos don't implant because they have genetic problems within the embryo, and we really don't have ways of being able to test the genetic constitution of the embryo. Yes, I know that we can do PGS and PGD and test for chromosomal aneuploidy, but there's a big difference between genes and chromosomes. Only 23 pairs of chromosomes. There are over 30,000 genes, and lots of these could have lethal abnormalities, so that even though the chromosomes are normal, that embryo is just not going to grow or implant. And that's what I meant about some of our limitations, and this is why people try all kinds of things. When standard medical therapy doesn't work, when patients have repeatedly failed multiple IVF cycles in spite of the cycle being perfect, we try what we call empirical therapy. I think this falls into two categories. There is one which is what I call the shiny object syndrome, where doctors want to try out the newest technology, the newest tests. These are the ones which other doctors promote in conferences. They're very expensive. All kinds of exotic, esoteric things like genetic testing, which includes PGS or includes endometrial receptivity assay. But they've not been proven. And the tragedy is not only are they extremely expensive, patients aren't told that they're not proven, which means effectively doctors end up using these patients as guinea pigs and, to add insult to injury, charge them an arm and leg for serving as the privilege of being guinea pigs, which makes no sense to me at all. I think empirical therapy, which is low cost, low risk, things like acupuncture, meditation, yoga, any of these things could work. Whether it's supplements like royal jelly, I think it's fair to try this and let the patient know. We don't know for certain whether it works or not, but you might want to try it. It might help you. But I think for other things, we need to learn to draw the line because it's not fair on patients. Because the problem is that there is no way we can actually learn whether that therapy helped that patient or not. For example, that patient could get pregnant, but you don't know whether it's because of your empirical therapy or something else. The only way to test empirical therapies is in a controlled clinical trial, which most IVF clinics aren't set up to do. And in fact, a lot of this empirical therapy ends up creating a lot of harm because of this anecdotal evidence that patients get biased, doctors get confused, and they start over-promoting stuff which may actually be completely ineffective. And I don't think that's fair for patients. So be careful, do your homework, and make sure there is evidence before the doctor advises you to do something. And if he doesn't know, that's fine. He should be honest with you. Not sure what's happening? Please feel free to connect with me. I'm Dr. Malpani, and I'm happy to offer a free second opinion on our website at www.drmalpani.com. See you there.